Hello everyone. Uh, Here we are discussing the topic chronic granulomatous disease today, one of the important topics from the immunology. So before really entering into the topic, let's start by going through the normal physiological mechanism in our body. So here we can see this is one of the famous pictures we have seen from the first aid and multiple other websites. And this is the respiratory burst that we can see whenever the bacteria enters the body, and the phagosome and the lysosome fuses together for the formation of the phagolysosome. By the utilization of the NADPH, in the presence of the enzyme NADPH oxidase, there occurs the conversion of the oxygen to the superoxide free radical, ultimately to the conversion of the hydrogen peroxide molecule and hypochlorite ion. And hypochlorite ion and the superoxide reactive oxygen species, they are bactericidal. They help in the killing of the bacteria in our body, and this is one of the example of the innate immunity in our body. So the important thing that lies here is like the NADPH oxidase is the first enzyme that initiates this whole process, ultimately leading to the killing of the bacteria. So this is the normal physiology of the respiratory burst that occurs in the phagolysosome. Here, this whole cell, that the whole process that has occurred inside is inside the neutrophil, which is the majority of the bacteria, majority of the cells that kill the bacteria inside our body. So respiratory burst involves the rapid and the intense release of the reactive oxygen species, notably superoxide radicals, by the immune cells like neutrophils and macrophages. These reactive oxygen species, including the hydrogen peroxide and hypochlorous acid, collectively contribute to the destruction of the engulfed microorganisms inside the phagolysosome during the phagocytosis. Another important thing that I would like to highlight here is this is through the similar mechanism we use the bleach to as the disinfectant in various purposes. So that's one of the mechanism how the bleach works. It ultimately gives the hypochlorite ion. So to enter the chronic granulomatous disease, why this physiology was important? Because in the patients with the chronic granulomatous disease, that is CGD, there is the deficiency of the enzyme NADPH oxidase. So CGD occurs most commonly due to an X-linked mutation affecting the NADPH oxidase, because of which the downstream mechanism doesn't take place inside the cell, because of which the bacteria are not lysed and patients are susceptible to the infections, recurrent infections. So neutrophils affected by this disorder are unable to kill the catalase producing organisms, resulting in the recurrent bacterial and fungal infections that frequently involve the lungs, skin and lymph nodes. So if we get any questions in the MCQs that suggests us that the catalase producing organisms is causing the recurrent bacterial and the fungal infections, that we should suspect that the patient might have the chronic granulomatous disease. Now the question might arise, why the chronic granulomatous disease patients are only affected by the catalase producing organisms? So to answer this question, here we can go to the chart again. The H2O2 is the hydrogen peroxide, and it gives rise to the hypochlorite ion that is most potent in killing the bacteria. So if the catalase is produced in the bacteria, its catalase is produced by the bacteria or the organisms, it is safely neutralized or safely converted into H2O and oxygen. We can see in this image when so when there is the, this is not deficiency, I think this is the, okay, when there is the deficiency of NADPH oxidase, the catalase positive organism can clear off the H2O2 that is minimally produced as a byproduct of the bacterial metabolic product. So as NADPase oxidase is absent, this whole mechanism is not occurring inside the body. So minimal of the H2O2 that is produced as a byproduct of the bacteria itself is neutralized by catalase, converting into water and oxygen, because of which the bacteria survives, and the bacteria can cause the symptomatic infection in the CGD patients. So the minimal amount of H2O2 that is produced in the NADPase oxidase deficiency patients is not able to kill the bacteria as the concentration is minimum, and it is minimally converted to the hypochlorite ion and the hydroxyl ion, because the bacteria has the catalase. So in the organisms which do not produce the catalase, the reactions take place is the catalase is not produced. The hydrogen peroxide that is produced is converted to the hypochlorite ion and the hydroxyl radical. So the hypochlorite ion, that is bactericidal in nature, is able to lyse the bacteria, because of which the catalase, non-catalase producing organism, or the organisms that do not produce the catalase, are not able to cause any harm to the CGD patients. So only the catalase producing organisms are susceptible to the patients with are able to cause diseases in the patients with CGD, and the patients are susceptible to only the catalase producing organisms. So far what we have understood is the catalase CGD is basically secondary to the NADPase oxidase deficiency, and the patients with CGD are only affected by the organisms that produce catalase. So we can move to the next part. So how the diagnosis is made. Often whenever the question is asked, this part is often tested in the exams. Chronic granulomatous disease is diagnosed by the absence of fluorescent green pigment on the dihydrorhodamine flow cytometry testing. So there is no change in the color if the patient has the chronic granulomatous disease. That is one test. And another important test is there is an abnormal nitroblue tetrazolium test, which is by abnormal we mean there is the absence of fluorescence again. So these are the two tests which helps us to diagnose the patients with CGD. And talking about the treatment, which is not much asked in a is not the common question that arrives in the test, but it is important to know that the patients with CGD are treated with lifelong antibacterial and antifungal prophylaxis, with or without the immunomodulatory therapy, depending on the criteria that the country follows. That is also, in addition to that, there is also guideline of early diagnosis of infection and aggressive management of the infectious complications. So at the tip of your tongue that you should be knowing, that you aren't allowed to forget as a medical student or the aspirant of the competitive exams, is that the CGD is the disease that is caused by the deficiency of NADPase oxidase. It is diagnosed by the no green pigmentation on dihydrorhodamine flow cytometry testing and the negative nitroblue tetrazolium dye or test. Neutrophils in the CGD are unable to kill the catalase producing organisms. So they are the most read and digest point from today's discussion. And last but not the least, what I present to you guys is the common mnemonics that we have seen in most of the common books, including the first aid. The catalase producing organisms that it's really important to know, because sometimes they are tested is the part of the different options, which organisms can be infective, can cause disease in the patients with CGD. So we need to select the organisms in some of the questions. So it's important to know that which organisms produce the catalase. So CATS, cats need places to belch their hairballs. Cats is the catalase producing organism and refers to the Nocardia, Pseudomonas, Listeria, Aspergillus, Candida, E. coli, Staphylococcus, Serratia, Burkholderia cepacia, and Helicobacter pylori. So I think this is all about the chronic granulomatous disease. I will be presenting the important or the interesting topics in the very short way that can be effective in revising in the short time during the examination. So I hope this was helpful for you guys. Hope to see you in the next video. Thank you so much. Take care. Bye.